today that decision is a complicated decision because there's two major types of treatments in metastatic melanoma. There's immunotherapy and there's targeted therapy. Those are the two major types of treatment that I use. Chemotherapy is not used a lot anymore. So in terms of trying to decide who is a good candidate for immunotherapy versus targeted therapy, I think the big difference is that targeted therapy, generally speaking, results in a higher response rate, while immunotherapy results in a lower response rate. And there's different types of patient who benefit from one versus the other. I think normal LDH is a factor that increases your response rate for either immunotherapy or for targeted therapy. I think less than 3 metastatic sites is known to affect your response rates for targeted therapy, and the presence of a normal ECOG performance status also is something that's good in both cases. I think a lot of times the decision comes down upon seeing if somebody has bulky metastatic disease, needs immediate treatment response, in which case we favor targeted therapy for those patients, versus patients who might have the luxury of time where you might consider immunotherapy first and then use targeted therapy later. I think targeted therapy has higher response rates, but the duration of response is known to be lesser with targeted therapy. With immunotherapy, response rates up front are lower, but the responses are known to be more durable. So I think to some extent it goes, it's an issue that you need to discuss with a patient and see, what is more important to a patient, having a response or having that more durable response and taking that risk of having a lower rate of response. But certainly somebody with normal ECOG performance status or with an ECOG PS of 0 and less than 3 metastatic sites, normal LDH, I think those are the patients who are known to have long-term benefit from targeted therapy, just to make the picture even more complicated now. So I think those are patients where you need to have a careful discussion, like with this patient who has M1b disease. We don't know what her burden of disease is and whether she needs a response immediately or whether she can wait, but that this is a reasonable patient to consider for targeted therapy.